Hi, I'm Dr. Vaibhav, consultant pulmonologist. Today I'll be talking about workplace-related asthma. So, as I've spoken in my previous video about what bronchial asthma is, so asthma, to remind you all, is just an inflammatory airway condition which leads to narrowing of the airways and also airways being filled up with mucus. It is basically when you breathe in fumes, chemicals, dust on the job is when we refer to it as workplace-related asthma. This leads to an allergic or immunological response. People with a history of allergies or a family history of allergies are prone to developing this, and also if intervened at the right time, it can prevent permanent lung injuries. Now let's look at the symptoms of workplace-related asthma. It is quite similar to your regular asthma, so it can start with a cough and it can lead to shortness of breathing or wheezing and also chest tightness. And it can also be associated with symptoms of rhinitis like running nose, sneezing and throat irritation. So how do we identify workplace-related asthma? So the asthma which worsens when you're exposed to a particular substance and which persists to stay even after that can be identified as a workplace-related asthma. It can worsen when you're particularly on that job. There are about 400 odd substances or chemicals which can cause workplace-related asthma. Now let's look at some of the most common causes of workplace-related asthma. The first one includes animal matters like dander, fur, hair, etc. Then there are some chemicals which are used in varnishes, adhesives, enzymes like detergents and cleansers, metals like platinum and chromium, plant-based substances like rubber, latex, cotton, flax, hemp and rye, and some respiratory irritants like chlorine gas, sulfur dioxide and smoke. When a person is exposed to these above mentioned causes, especially the ones with a history of allergies or ones who have a history of asthma, develop airway inflammation and they can present with the symptoms. So when your symptoms do not relieve on taking reliever medications, when you're having symptoms like mainly breathlessness, even on minimal activity, so the ones who have allergies or family history of allergies, the people who have asthma previously or who have been having a mild persistent asthma or using inhaler medications for the same. Also people dealing with the above mentioned causes in those particular occupations are at higher risk. The basic precautions firstly would be to prevent exposure, then avoid smoking. Losing weight could also help in the long term, and also to get flu vaccinations at the right time. Some of the other basic precautions which can be taken at your workplace is to avoid strong odors, keep the workplace clean, avoid strong allergens at the workplace. Check your air quality and ventilation, check the temperature which is to be right at the setting, and also if you're a known asthmatic or you have prone history to allergies, keep a reliever medication handy. Now that we have understood what workplace related asthma is and what the symptoms are, so do visit your doctor if you have any of the symptoms mentioned and get treated at the right time. Doing this can avoid permanent air damage and also help you lead a healthy life. Thank you.